Okay, to start out with this dressing change, I am going to walk into my patient's room, check their name and date of birth, then I want to perform hand hygiene and get gloves. Then I'm going to take my alcohol swabs and I am going to go around the edges of the techoderm so that it doesn't hurt as bad when I rip it off. And you just kind of take it off. And then you're going to take it off from the bottom to the top so that you don't rip the catheter out. Then you're going to discard your techoderm and take your bio patch off and discard of it too. Then I'm going to take my gloves off. And after I take the techoderm off, I'm going to assess the site for any redness or edema, signs of displacement or infection. And then I'm going to take my mask and put it on my patient and turn their head away from the site. Don my sterile gloves. Discard this, and I'm going to take my drape and place it there. Then I'm going to take my core press and I'm going to clean the site for 30 seconds. I'm going to make sure I clean around. And I want to clean this. Then I'm going to let it dry without blowing on it or fanning it. And then I'm going to take my bio patch, which is already in my kit. I'm going to take my bio patch and put it on around. And you can secure it with tape if you'd like, according to your company policy. And then I want to take the techoderm and I am going to place it on the site. And after that's done, I'm going to take this sticker so I can label with my initials the date that I changed it and the gauge. And that's so any oncoming nurses know when it was changed last. So when I'm administering medication through the central line, I'm going to walk in, explain what we're doing, and identify my patient, introduce myself, perform hand hygiene, and put on gloves. And then I'm going to make sure this clamp is unclamped and I'm going to block the end of it with an alcohol swab, and then I'm going to flush the line with 5 to 10 milliliters of normal saline using the push-pause method. And then I'm going to administer the medication, and then I'm going to flush again with 5 to 10 milliliters of normal saline using the push-pause method, and on the last milliliter I'm going to clamp the line. Then I'll attach a swab cap and perform hand hygiene. Okay, so when you are drawing specimens from your central line, you're going to walk in, introduce yourself, identify the patient, and explain the procedure. And you're going to perform hand hygiene and don your gloves. And then you're going to make sure your line is unclamped, and you are going to wipe the end with an alcohol swab, and you're going to flush with 10 milliliters of normal saline, and with the same syringe you're going to pull back 10 milliliters of blood for your waste. And then you're going to take a 10 milliliter syringe, attach it, and draw up your lab, and set that aside so you can put it in your specimen vials. And then you're going to take 20 milliliters of normal saline and flush it so that the blood doesn't hemolyze and clog up the line. And then you're going to clamp it on the last milliliter and attach the swab cap.